Welcome to StrengthWarehouse Lightning Cast, and I'm your host, Nate Boley. Welcome to the show, Shawn. Go ahead and introduce yourself.
Hey, Nate. Thanks for having me on. I'm Dr. Shawn Lutz with Dynamic Sports Rehab. I'm a chiropractor. I specialize in sports medicine and exercise rehabilitation.
That's awesome. And you've definitely helped me out in the past. So what's some of the worst lifting injuries that you've helped people through?
Ooh, that's a good question. I've seen quite a few pretty severe injuries over the years, some gnarly shoulder dislocations, large tendon ruptures, avulsion fractures, stuff like that. But for me, the worst injury is the injury that it's hardest to rehab, the hardest thing for an athlete to get back to their sport. And for lifting, the thing that jumps out the most is actually an impingement or osteoarthritis of the hip.
Arthritis, that sounds like something that you get when you're really old.
Yeah, well, a lot of osteoarthritis is in our elderly population, something we see a lot with older folks. But as athletes, we're actually at an increased risk for developing some osteoarthritis if we have poor movement patterns and repetitive loading cycles that are putting extra stress on our joints.
So basically like doing the same movement over and over and over again without any changing.
Yeah, exactly. If you're not producing enough variability in movement, or if you're doing something in bad form. I like to think about this like if you're bending a nice green twig and you get that nice big curve, things run smoothly. If you try to do a nice sharp angle with that stick and go really tight, that stick can snap. So you want to keep that
totally.
tension, you want things to snap. So keeping that that balance in your movement is key.
Totally. Awesome. So what are some of the main things you'd say to an athlete at any level that they could do to increase their resilience and longevity in a strength sport?
That's another great question. Resilience is something that's really important to me and something that I really try to hammer home with the patients that I work with. The key is smart progressions and great movement patterns. And if you're going to accomplish that, the best way to do that is to work with a trainer, somebody like yourself, Nate, who's going to really keep an eye on form throughout the workout cycle, and also be able to program so you know you're progressing appropriately. You're not making huge jumps that your body's not able to adapt to.
Totally. Yeah, I've been trying to do a little bit of variable movements. I mostly do powerlifting, which is one plane of motion, but I've been implementing some more like strongman stuff like that. So you get loaded in different ways, and I think that's huge for for powerlifting, because I'm going to be loading in different areas and not working that same plane of motion all the time. So.
Yeah, you got it. That's exactly right. Variety is the key to resilience and longevity. So anything that we can do to move out of our groove, our normal movement patterns, develop a little bit of buffer. So we get into when we go outside of our prime movement pattern, we get into that area where we have a little bit less strength and stability, and things can break down. And even if we're really diligent with form, we'll lose that form at some point if we're not careful, often near the end of a workout. And that's perfectly normal. The key is to have that extra resilience, extra strength and stability to catch that and make sure that that results in maybe a little extra soreness, but not a major injury. So like you
totally.
said, workouts are awesome. Kettlebell workouts, yoga, animal crawls. Really, the variety is endless. Just doing something that's fun and mixing it up a little bit. That's the key.
Totally. Awesome. What are your thoughts and suggestions on frequency of recovery sessions per week?
Yeah, well, that's pretty variable, and it depends a lot on your experience with the sport. In your case, is this the first time you're trying to build up for a competition? Are you building up for a competition, or is this some other goal that you're trying to reach? And that's where I recommend working with a trainer as well. Having somebody who really understands your body's physiologic adaptations and is able to manage those so that you get the best outcomes, but also stay safe. That's the key for me, and why I recommend anybody who's starting a new sport, connect with a coach, get some advice on how to best achieve your goals, and listen to your coach. They know what they're talking about. So
totally.
In my case, I'm right next door to you. Real easy for me to send somebody your direction and say, hey, go see Nate. He'll help you out with your form, and that's the key, form and programming.
Totally. I just recently got myself a coach because I was finding it hard for me to program and do the stuff that I know that I should But being a coach, when you coach yourself, you sometimes like, I don't really need to do that or this, but you don't hold yourself super accountable, even though you hold your clients accountable. So now I'm like, okay, I need to be held accountable. So I've got a coach now, and he's definitely holding me accountable. So I second that, what you're saying.
That's
All
the
right.
key.
So,
Somebody else to help every once in a while, and even if it's an
yeah,
area we have expertise, looking to somebody else for that is awesome. So I'm glad
yeah, just
glad
a
that
little,
that connection.
yeah, a lot of times you can see, a lot of people can program themselves and stuff like that, but it's nice to have a second pair of eyes to watch, because you can't always see yourself lifting from the outside. So, or
Totally.
you can't always see the things that are breaking down or how to fix those things.
Oh
So,
yeah, I completely agree with you there. I should know better, but multiple times over the years I've injured myself doing sport, and purely because what I thought in my head I was doing was different from what I was actually doing. And if I had another
yep,
set of eyes on me, I would have been able to prevent
yep, totally. All right, one last question. If a lifter is experiencing an issue, when do you think they should seek professional help?
that. Okay, yeah, that's a good one, and it depends on the issue that you're experiencing. If you got something that comes on within one session and you get sharp, severe pain that's limiting function, go right away. Don't wait. But if it's something that's kind of niggling, bothering you, not preventing you completely from working out, but it sticks around, if it's gone on for more than 2 weeks, go get it checked out. Chances are it's not going to be going away on its own. And if you ignore it, it's just going to keep getting worse. The easiest thing to do is to nip it in the bud, address it when it's a minor issue, and can actually open up some performance gains quite often when we see that
Totally.
inefficiency leading to the symptoms or the pain that the patient or client's getting.
Yeah, and personally with me, I have done the opposite of that. I've mostly worked through things until they're too, pretty severe, and then I have to come see you for several weeks, and I know you hate that. So,
Well, you know, you're not alone with that. And
yeah,
if I did this perfectly, I would be in the same boat there. But we all have that tendency to think, you know what, this isn't a big deal, or oh, it really hasn't been bothering me too much. So I'll even tell people to write something down. If you feel some pain with your workout, put a little jot down in your workout journal and say, today I
totally.
had some pain in my hip. Then you can look back, and when 6 months later you have that pain again, you see, oh, you know what? I did have that pain previously. I should probably go get this checked out. It's not something that's
Yeah.
presenting today. This is a pattern. And those are the things that we
Hmm.
want to catch early. We don't want to drive ourselves down a poor movement pattern a highway. We want to stick with keeping things smooth, keeping things balanced.
But then you also have to worry about, if you've done it for a long time, your body becomes adapted to working in those bad forms, and then once you've healed it, then you have to relearn how to move in the correct pattern again, and it's like, it's like a double whammy on that part.
Yeah, that it is.
Yeah,
And retraining the pattern is way, way harder than teaching the pattern right the first time. So yet again,
yeah,
that goes back to, if you're starting a new sport, work with a coach, do a
yeah,
good job getting your form down as good as you can, and then just practice. It's all about iteration. Keep repeating those practices, and you'll get better. And if something comes up and you're not able to do the movements well, it doesn't feel good, doesn't feel efficient, and especially if you're getting significant pain, talk to somebody. If your coach can't find the issue, then get in with a sports med professional, and we'll be able to help you out with that.
totally. Well, I think that's all the time we have today. I want to thank you, Shawn, for dropping in and giving us some knowledge today. Just so our listeners know, how can they get a hold of you and find the
Awesome.
information that you have?
Yeah, well, appreciate you inviting me in, Nate. Great chatting with you. Always a pleasure. You can reach me at dynamicsportsrehab.com. That's going to be the easiest way to get all our up-to-date contact information. We're also on Facebook as well, but feel free to reach out and give me any questions you have.
All right. Thanks for joining us, Shawn. I really appreciate it.
My pleasure, Nate. Great talking to you. Have a great one.